OMNIBotics, robotic-assisted total knee replacement. Introducing the latest in knee replacement procedures. OMNIBotics, the patented robotic-assisted technology for total knee replacement. Using state-of-the-art 3D bone morphing and robotic-assisted instruments, surgeons are able to plan and execute a total knee procedure with a high level of accuracy and control. The results? A knee replacement that is precisely fit and aligned based on the unique requirements of your anatomy for a knee that feels like new. The goal of total knee replacement is to replace the damaged cartilage and bone of the knee with an implant system to restore normal and pain-free motion. The Apex knee system consists of 4 components. The top of tibia or shin bone is replaced with the tibia base plate. The end of the femur or thigh bone is replaced with the femoral component. And an articular insert is placed between the 2 components to function as the sliding interface. A small button is also attached to the rear of the patella or kneecap. These components work together to replicate the natural motion of a healthy knee joint. Successful knee replacement is dependent on many factors, including precise leg alignment and implant fit. With traditional knee replacement systems, surgeons relied on a set of universal cutting guides used to reshape the bones in preparation for implants. Alignment of these guides was often determined by hand, using a long rod inserted into the femur. This method of aligning cuts can be imprecise, and even a skilled surgeon could be off by a few degrees. Here we see how a small shift of only 3 degrees can translate into misaligned cuts, resulting in misaligned implants. This misalignment can cause pressure points within the knee, causing additional pain and swelling, and even premature implant failure. This risky and intrusive method of alignment can be completely avoided by using OMNIBotics. Now, let's compare how the OMNIBotics system can overcome these implant alignment problems, assisting the surgeon with real-time information throughout the entire procedure. First, the surgeon attaches computer sensors to the upper and lower leg. Much like GPS, these sensors continuously track the leg's motion, communicating wirelessly to the workstation's camera. This allows the surgeon to preoperatively evaluate the knee's entire range of motion, guiding it through a series of flexing and rotation motions. The graph on the left records both range of motion, or leg flexion, and leg stability, a measure of the knee's side-to-side looseness. In this example, we see many horizontal bands falling outside the normal range for leg stability, indicating this patient's preoperative knee is fairly loose and unstable. Next, using a small handheld pointer that communicates wirelessly with the workstation's computer, the surgeon traces the contours of the knee joint. The computer uses this data to map the exact shape of the femur and tibia using patented OMNIBotic bone morphing technology. With the data collected, the computer is able to build and display a complete 3D representation of the joint on screen. The computer automatically calculates implant sizing and alignment based on the patient's anatomy, allowing the surgeon to visualize and fine-tune how the implant will fit and function before any bone resections are performed. When the surgeon is satisfied the implants will function properly, the bone resection process begins. Based on the surgeon's plan, the robotic guide automatically rotates to the proper angle for the first cut. A handheld surgical saw is inserted into the guide and the first cut made. The robotic guide automatically advances through the remaining 4 cuts, precisely aligning the guide each time to the correct angle and location. The surgeon has complete control of every cut and can even make small adjustments to ensure the results match the surgical plan. The surgeon next reshapes the tibia. The OMNIBotics system confirms the cutting guide is exactly positioned as indicated by the surgeon's plan, so the surgeon can make a single precise cut. With bone preparation completed, the surgeon will next insert and assemble the implant components securely into the knee. Finally, before the leg tracking sensors are removed and incision closed, the surgeon will once again use the OMNIBotics system to quantify and confirm the patient's postoperative range of motion. Here we see the after results are consistent with a healthy and normal knee, and that alignment has successfully been achieved. Your surgeon may even share these before and after graphs with you during recovery. Most patients can expect a speedy recovery and should closely follow the advice of their surgeon and physical therapist during the recovery period. Now, with a knee that feels like new again, you can get back to enjoying an active lifestyle with family and friends. OMNIBotics. Precision you can feel. Ask your physician if you qualify for OMNIBotics Total Knee Replacement. Learn more about OMNIBotics by visiting our website at omnils.com.